I'm Roger Stark. I'm the healthcare policy analyst at the Washington Policy Center. So I'm sitting over there and Brandon's saying, put a cheery spin on whatever you're going to say, because it's kind of a downer tonight. So what I'd like to do in my few minutes is actually discuss in some detail the federal health reform legislation that was passed last month. As most of you know, that legislation ran to 2,700 pages, and I believe if we start right now, we can probably finish by June 1st. So, let me get started. Actually, what I'd like to do is just discuss a couple bills that we looked at on the state level. The first one was a bill that dealt with being able to purchase health insurance across state lines by individuals and by small groups. We thought this was an excellent bill, went a long way to providing a bigger market and a freer market in healthcare in the state of Washington. Unfortunately, that bill did not make it out of committee. The second bill I'd like to discuss with you is one that actually was passed. This was a bill that actually put a bigger tax on hospital beds and nursing home beds. And the idea here is if you tax hospitals and nursing homes, you can then take those tax dollars and you can put them into your Medicaid fund, which expands your Medicaid dollars. Say, why would you do that? Well, as most of you know, Medicaid is half federal and half state. And what that allows then is more federal dollars to flow into the state. Now, as though we had a crystal ball, about a month or 6 weeks before that bill passed, we actually wrote a fairly extensive policy brief on that very thing. We called it, originally we called it Medicaid fraud, and we decided that wasn't exactly accurate. It's closer to Medicaid abuse. This is actually not discouraged by the federal government. The bill passed with bipartisan support, simply because these are federal dollars that are going to come into the state to help refinance our Medicaid system. You might ask yourself, why should national taxpayers be paying for Washington's Medicaid system? And I can't give you a good answer. All I can say is the federal government does not discourage it. We brought a few copies of the study with us. It's out at the table. Please feel free to take advantage of that. What I would like to do is discuss a state program with you tonight, and it's not a Washington state program, it's the Massachusetts healthcare program, in just a couple of minutes. So you say, Stark, why are you going to do that? Well, Romney Care, it passed in 2006, and the reason I'm going to do that is because it is the template for national health reform legislation that passed last month in the state. In 2005, Massachusetts had an uninsured rate of about 10%. The national average was about 15%. So actually, they were lower than the national average. They had a Republican governor, Governor Romney. They had a Democratic legislature. And they thought that 10% rate was too high, and they thought the state could do a better job of providing insurance. So in 2006, Romney Care began. And Romney Care has an individual mandate. Romney Care has an employer mandate. And Romney Care has an exchange, or what they call a connector in Massachusetts, where the state government subsidizes insurance plans and insurance policies for the residents of the state of Massachusetts. So they dropped their insurance or their uninsured rate from 10% down to about 3%. It's not universal. They were shooting for universal, but they got it down to 3%. But then three things happened. First thing that happened was, with all of these newly insured patients, demand exploded. And the second thing that happened then was access went down. They didn't have enough primary care specialists or anything, such that in 2008, wait times in parts of Massachusetts, for example, Western Massachusetts, were up to 12 months to see a primary care doctor. So demand exploded, access went down, and the third thing is the cost overrun was phenomenal. They had budgeted, and by 2008, they were over $1 billion over budget. And the governor of Massachusetts went to Washington, D.C., hat in hand, to get federal dollars to support their state program. So again, you say, okay, Stark, that's Massachusetts. Why are you bringing that up? The reason is because, as I said, it's the template for the healthcare reform that was passed last month. And we anticipate that this very thing is going to happen nationally. Demand will explode, access will go down, healthcare will be rationed, and what we will see then is huge, huge cost overruns and deficits. The last 14 months, we've done some on the state level, but as you can imagine, our healthcare work has done a lot to revolve around the federal issue. We're planning here in the next couple of months to release a series of papers on the impact of national healthcare reform on the state of Washington. Two of the drafts are already in progress. The impact on providers, the impact on businesses, particularly small businesses in the state. We're looking at one, the impact on Medicaid, Medicare recipients in the state, the impact on innovation, healthcare devices, health insurance carriers, drug companies, things like that in the state. So we've got those papers in the works. In closing, let me invite you to our healthcare conference. It's June 4th. This will be our 8th annual conference. We're very pleased with how the program is shaping up. Attorney General Rob McKenna is going to give an update on the lawsuit that he's currently involved with. We are then going to have 2 panel discussions dealing with very specific aspects of national healthcare reform. And then our luncheon speaker is Professor Regina Herzlinger, who is one of the 100 most influential policymakers in the healthcare world in this country. She's a professor in the Harvard Business School. We're looking forward to a tremendous conference. As I say, this will be our 8th annual. It's at the Doubletree, SeaTac, June 4th, 8 to 12:30, 8 to 1 o'clock. Thank you very much. I am available for questions as well.